Hey guys, it's Dr. Davis. Today we're going to talk about vitamin D. It's a very important vitamin and at a high level also a hormone. We'll talk about how it's made and what it's used for. So what is vitamin D? Vitamin D comes from cholesterol, just like testosterone and estrogen and progesterone and all those other steroid type hormones. It has a slew of things. I've been a doctor for a little while, and I remember when when I was a little baby doctor, we didn't even check for it. I mean, if you had osteoporosis, we might think to check for it. If we happen to cross our mind, we might check for it. But I'd be willing to bet that literally all of my patients are checked for it all of the time, at least twice a year, sometimes more. And I can tell you that in 2009, there was a big study done, and all of the American participants in that study, 77% of them were low in vitamin D. So let's define what low means. Well, it just depends. I think that the lighter your skin is, the higher the number needs to be. And the darker your skin is, the lower the number needs to be. And forgive the generalizations, that's just the way it is. So as long as you're at least a 50, I cannot count the number of times that my patients come back in the 20s. I mean 20s. And why is that important? Goodness, the list of diseases that vitamin D deficiency can cause is dramatic. It has grown from us not really knowing, calling maybe osteoporosis, to everything from prevention, probably, of colon cancer, heart disease, hypertension, depression, schizophrenia, joint pain, muscle pain, fibromyalgia, bone pain, low back pain. It goes on and on and on. I have family and friends that when they don't take theirs, their feet burn. When I don't take mine, my left foot kills me. I can tell that my vitamin D is low simply because of my left foot. It's an amazingly powerful vitamin/hormone. So I tell people all the time, and I've said it in my previous videos, that if you're gonna fix something, fix your thyroid, fix your testosterone, and you must also fix your vitamin D. So let's go through the history of vitamin D. We all know, or at least I think most people know, that when your skin, which is the largest organ of your body, gets exposed to UV light from the sun, it makes vitamin D. Wow, that's dramatic. And you may not know this, but humans began around the equator. We were all kind of centrally located, and we were dark of skin, and we were around the equator. And we had a lot of direct, straight above sunlight shining down on us. And most of our body was exposed most of the time. We didn't walk around like we do now in full clothes with powerful sunscreens on. And so did you know that it only takes for a light colored skin person, it takes about 20 minutes of direct sunlight to make 10,000 IUs of vitamin D. Pink skin, from the sun, a bunch, up to 20,000 IUs of vitamin D. The darker your skin, the more sunlight it takes, but not hours, minutes. You're up to 40 minutes if you have dark skin. And you've got all the vitamin D you need. However, you got to have a lot of skin exposed. You got to have your torso, your arms, your legs. And then that brings up all the risks of being out in sunlight. We were all very worried about sun on our skin. And I'm a redhead, freckle-faced, Scotch-Irish, half German. I'm worried about the sun. I go out, you see me outside in the sun, I have a long sleeve swim shirt on, I have a hat on, I have sunscreen, my nose is white. I'm not doing myself a favor when it comes to vitamin D production. But I find myself making sure that I get 20 minutes of sunlight as often as I can now on the majority of my body whenever I can, because I want my D to go up. However, I don't do that consistently enough, and I live a primarily indoor lifestyle, so I make sure that I take my vitamin D, and I take a lot of it. Now, in the clinic, it's important that your doctor know what they're doing. In my mind, it's a hormone because it is at the high doses, and I don't want any of the disease coming from it. I don't want to hurt. I don't want to have fibromyalgia. I don't want my muscles to kill me. I don't want my feet to be numb. I don't want my heart to get affected. I don't want colon cancer if that's proved. We know those diseases are linked, but we don't know if that proves it. In fact, there's some significant studies recently with this COVID virus showing that one of the biggest protectors from having severe case of COVID is a above 80 vitamin D level. Now, our recommendation would be above 50 at least. Anytime you get over 100, that can be a little troubling. We don't want to get above that. So we're shooting for that. In my mind, we're shooting for 50 to 100. So I'd shoot for 75, 90, whatever it takes. In the clinic, we only sell 5,000s and 10,000s because that's what people need. And I remember when I first started, I'd give 1,000, and then I'd give 2,000, and now I'm at 5,000 to begin with and 10,000. And we adjust up or down depending on how much vitamin D you absorb from your diet. So you can only absorb 12 to 1,500 IUs from your diet, even if you're supplementing. So if you're taking a 10,000 or a 5,000, but sometimes you just have to flood the system with as much as you can get in there so your body has enough of it to scavenge the 1,200 that it can get in. Most of you, me, point all those back at me, live an indoor lifestyle. And the majority of your time is spent indoors. You're not going to get sunlight. You're just not. And if you do, it's going to be on your little face. And you might have sunscreen on your little face too, because your esthetician told you had to. And I agree, because we don't want these sunspots that are showing up to get worse. And it's not my torsos, it's not my front and my back, it's not my arms and my legs getting as much sun as I need to. And certainly not in the winter. The further north you go, the lighter the skin person that there is, because the skin lightened up and lightened up and lightened up, and the hair lightened up so that the vitamin D could be produced with less direct sunlight. The sun hits the equator, and then as you go north, it angles and you get less direct sunlight. You ever been on a cruise? You burn like that. And so that vitamin D production is probably the main reason the skin changes and lightens up as you go north. So the standard American diet, you know what that is. You're all eating it unless you're listening to me. Gives you about 300 IUs of vitamin D. You take, in the clinic, we take 5,000 and 10,000. It's important to know that with this indoor lifestyle that we've got going on, internet, air conditioning, blankets, all the good stuff that we do indoors is not benefiting your vitamin D, and it's increasing your risk of heart disease, arrhythmias, hypertension, cancer. Vitamin D is very cancer protective. It's very immune boosting. So now we're locked up indoors and sheltering in place, and our vitamin D levels are crashing even further. So it's extremely important that we understand how crucial vitamin D is for your bones. Obviously, vitamin D deficiency and osteoporosis are linked. Vitamin A, vitamin D, vitamin E, and vitamin K are the fat-soluble vitamins. The product that we sell in the clinic is ADK. It's got all three of them in there together. We get E from a separate source, but you need them all three. They work together. So I would advise you that if you're not taking something that has A and K in it, or eating specifically to raise your A and K, you should take all three together. And those products are available. We have them. They're also available on Amazon or wherever else you want to get it. But I would take ADK together. It's very important that you have all three. In a nutshell, the calcium, that the D pushes the calcium into the body. A low D allows calcium to slide back into the bloodstream, and it's not supposed to be there. Just vitamin D by itself very likely pushes the vitamin D back into the body, but anywhere, maybe even into the artery wall. So A and K chaperone that, but they also do a myriad of other very important functions. Those fat-soluble vitamins are crucial. So take them together, unless you are significantly paying attention to your diet and you know you're eating foods rich in those things. Now, if you're on a very restrictive diet like I choose to be, I have to supplement them because I'm not going to get them dramatically or enough from my diet that I'm choosing to eat. So that's what I take. I take one pill, ADK. I'm light skinned, half German, half Irish. I have to take it. I don't get enough sun exposure. I just don't go out in the sun like I should. So I take 10,000 and my level is 90. That's what I do. I know my level. I know how much I take. When I take 5,000, my level is 60. Probably adequate. We can argue all day about whether it should be 50 or 100. As long as it's not above 100 or below 50, I think you're doing a great job. And it's important that that lab that I'm talking about is a vitamin 25 OH. And it's important to know that when you take vitamin D, in my opinion, and many, many others, you don't take that vitamin D2 stuff. You take the vitamin D3. And it doesn't require a prescription. You can get it anywhere. And you need to know your levels. And so what we're after is bone protection, heart protection, cancer protection. I tell guys all the time, men's wellness is a three test thing. What is your testosterone? What is your vitamin D? And do you have sleep apnea? And is it properly treated? If you don't fix the D, in men or women both, fatigue will be a problem. It just will. You will hurt. Your muscles will kill you. It just isn't. And it's hard sometimes for us to believe that a vitamin that I can buy at the store is that strong. It is equally strong to testosterone, or let me say it this way, it is equally important to testosterone, because if you don't fix them both, you will not feel good. You're just missing the boat. So yes, you can get vitamin D. You need at least 20 minutes of strong direct sunlight on the majority of your body every day. So on those days where you do that, I would protect the sensitive areas. I call it the sun's windowsill right here. I would sunscreen these areas for sure. Maybe the tops of the ears. If you don't have hair in the back of your head like some of us, you got to make sure those areas are protected. But the rest of your body, boom, boom, boom. You need to get 20 minutes. I'm not talking about slathering up with oil and laying out there for 2 hours and getting as dark as you can. That is not the kind of sun exposure I'm talking about for vitamin D. It's just 20 minutes and you got it. If you'll do that every day, there's your vitamin D, but it's got to be the majority of your body. Front, back, torso, arms, and legs. And so I guess what I'm getting at is that's probably not going to happen. It's just not. So take your vitamin D, 5,000 at least. Check your levels. If you're too high, back off. If you're not high enough, take more. You want to be above 50, but below 100. And really dig in and find out why, people think they have fibromyalgia. They think they hurt. They think they need to go to the rheumatologist. And you might. But if you don't have your testosterone, your vitamin D, your thyroid fixed, you're missing the boat. And let's start there. Make sure your doctor knows what they're doing. Come see me. I know what I'm doing. I'll be happy to help you. Here at the Davis Medical Group, Body Goal MD, we check all that stuff all the time. It's one of our most important priorities is to get your hormones optimized. And I consider vitamin D a hormone. All right. Well, have a great day. We'll give you some more of this. If you see my YouTube link on here, please go to my YouTube channel and subscribe. That'll help me. I think that the more subscribers I get, the better. And I'm going to be making more like this. As the clinics go on and topics come up, I want to make sure you know what I think about these things. Am I right? I don't know. I think I know what I'm talking about. I think I've really tried hard to use common sense and apply it with my medical knowledge. And that's what this is just my opinion. So have a great day. Bye.